Okay, third question. A 65-year-old woman schedules an appointment with her physician because of weight loss and weakness over the past 5 months that is getting progressively worse. The weakness is more noticeable when climbing stairs and combing her hair, but it improves after brief exercise or repetitive movement. She also has experienced bladder incontinence for the past 4 weeks and was given an anticholinesterase agent with no improvement. She has no other significant past medical history except smoking a pack of cigarettes daily since age 17. Her vital signs are within normal limits. Physical examination reveals moderate symmetric weakness of the upper and lower extremities. What is the most likely cause of? Most of you are saying option E. We'll just go with that. Okay, so 65-year-old woman schedules an appointment. Okay, fine. Okay, so the important thing to note in this is that she's having weakness. Okay, so it says weakness is more noticeable when she's climbing stairs and combing her hair. So when you look at something like this, the first thing you should think of is not why it's happening, but rather which muscle group it's actually affecting. Okay, so in some cases, they will directly mention whether it's proximal myopathy or distal myopathy. But in some other question stems, they'll mention this, especially for questions regarding polymyositis and dermatomyositis, which come in musculoskeletal. They will never mention proximal. They will just mention the muscle groups or the actions carried out by those groups. So the act of climbing stairs is by your proximal leg muscles. Okay, and combing your hair is once again by your proximal arm muscle. So based of this one line, you can kind of arrive at a proximal muscle weakness. Okay, the next important thing is that it improves after brief exercise or repetitive movement. So with this second clue, I can very easily rule out myasthenia gravis. Okay, because myasthenia gravis is something that sort of gets aggravated towards the end of the day, or as more work is done, it sort of gets relieved only on rest, not on exercise. Okay, so with that I can rule out option D. However, if you're not very convinced with this line, you can go on to the next point, which says that she has also experienced bladder incontinence and was given an anticholinesterase agent with no improvement. So the drug of choice in myasthenia is an anticholinesterase like neostigmine. So had the patient had myasthenia, neostigmine should have helped. Okay, she should have had a betterment of her symptoms, but she doesn't. So once again, just proves that it's not myasthenia. Rule it out. Hypothyroid. Okay, I'll go from the top instead of going into this haphazard way. Botulism. Pretty rare for someone this old to have it, but even then, if the patient was to have botulism, just think of a descending paralysis. Okay, so the way you think of is that it kind of affects right from the start and reaches all the way to the bottom, and most of the time respiratory muscles kind of given your diaphragm gets affected and they're going to go for respiratory insufficiency pretty much. Okay, so descending paralysis for botulism. However, in contrast to this, just remember that Guillain-Barré syndrome causes an ascending paralysis. That's kind of how I always remember this. So like botulism is descending, Guillain-Barré is ascending. Otherwise, the symptoms are pretty much the same. It's only the direction of spread in the two that actually differentiates them. Okay, the second option is Duchenne muscular dystrophy. Very, very unlikely. Firstly, this is something that young boys get diagnosed with, and most of them don't really survive beyond middle age. And it's very unlikely for a 65-year-old woman to be having this now. Moreover, this is something that kind of runs in families. Okay, so nothing of that has been mentioned. Just rule it out. Okay, if they expect you to, guess the answer is Duchenne muscular dystrophy, there'll always be, very, very young boy child. And very young, I'm talking about around the age of 2 to 4. That's usually the age group that they select for the question. And apart from that, they will classically describe the entire Gower sign. They will not mention it as Gower sign, but they will explain, how the child has to, stand up by using his hands. So that is one very significant thing that indicates Gower sign. And another thing they might mention is the calf pseudohypertrophy. So anytime you see these keywords, you don't even have to read the rest of the question. Just go confidently with Duchenne. Okay. So the next one is hypothyroidism. Hypothyroidism can cause proximal muscle weakness. However, it's important to know that in this case, patient has had weight loss. Hypothyroidism, patients usually have weight gain. Okay, so with that alone, you can just rule it out. You don't have to go too much into detail about that. Just know weight gain, patient has weight loss, it doesn't fit the criteria, rule it out. Myasthenia gravis, I already mentioned. Now coming to the actual correct answer for this question, it is a paraneoplastic syndrome from small cell carcinoma of the lung. So like I mentioned in the previous one, these paraneoplastic syndromes are kind of what help you narrow it down to small cell and differentiate it from non-small cell. Okay, so in this case, it is your Lambert-Eaton myasthenic syndrome. in which autoantibodies are pretty much produced against the calcium channel in the presynaptic region, because of which there's going to be decreased release of acetylcholine, because it's the influx of calcium that actually helps the vesicles that contain neurotransmitters to fuse with the synaptic end or the bulb, and hence getting released into the junction. But since that's blocked by these particular antibodies, you're going to have this. So typical signs of Lambert-Eaton, you're going to not have a response to neostigmine. You're going to have an improvement on brief exercise or repetitive movement. You're going to have proximal muscle weakness. And very, very important thing is that they also have autonomic features, like in this case, bladder incontinence. Okay, so just keep all of this in mind and you'll be able to diagnose it. But even otherwise, like I said, questions like this, if you're not sure, just rule out everything else, you'll arrive at the answer.